And the point about if you can get companies and other organizations to invest and work in your area, and you can gain the benefits of money to a certain extent, but also expertise, that ought to be a huge boost to that particular integrated care system. Healthcare is, as always, one of the most important issues we face as a country, one of the most significant things members of parliament have in our postbag. So our minds are on it all the time, pretty much. Anyway, obviously, with the topical aspects in the news at the moment, more so perhaps than usual. Also, you look at COVID and you look at our recent history, the challenges we faced going through COVID, the lockdowns, and the challenges of kind of recovering from that. There are so many aspects to healthcare which are of great importance. Now, healthcare does to a significant extent at the moment fit into the devolution agenda. So the Conservative government, actually following on from the previous Labour government, has been doing a great deal of work in terms of devolution. So Tony Blair gave significant devolution to London, Wales, and Scotland. And then George Osborne, David Cameron followed on from that and gave, you got police and crime commissioners, and you've got an agenda of devolution with mayors, which is being rolled out slowly but surely across the country. So every so often you'll see another announcement of another mayoral authority being set up. So I think Greater Manchester is 2014, and it didn't include healthcare. In 2016, the government decided at that point we would have health and care, social care devolution to Greater Manchester. And it's quite interesting, both when devolution was given to Manchester in general in 2014, there was actually a bit of a political scrap. The government of the day wanted a mayoral model, and generally speaking, the government of the day gets their way. But locally, there was a far greater interest in having devolution to local authorities, and in Greater Manchester, local authorities working very effectively together with one another. And when it came to health devolution in Greater Manchester, again, that wasn't intended locally or wasn't desired locally to be devolution to the mayor and the Greater Manchester Combined Authority. They wanted far more of a local authority, a partnership model, but national government wanted this agenda. And now, fast forward, we had the Health and Care Act last year, 2022, where you have the integrated care system rolled out right across the country, put it on a statutory footing. So there are huge opportunities. So I think it was great turning up early to listen to the last panel. And those points about the silos, such an important thing of the integrated care system is breaking down those silos. Not just forcing people to work together, but giving people the opportunity to work together as well. And there are different aspects. There's one aspect is if you make savings in your integrated care system in your area, well, sometimes, historically, if you make those savings, do you get the benefit of those savings? Can you keep that money locally? Do you get the opportunity of reinvesting it in the area? And there's a question, therefore, of motivation. Why would you put that time and effort to innovate sometimes if you don't locally get the benefits of it? And I think the integrated care system, very early days, has huge opportunity to break down those silos. Now, another aspect, I think, in terms of the integrated care system, again, this is touched on before, is the relationships that can and should be built with the life science sector, with pharmaceutical companies, with medical devices companies, universities, other institutes. There's a huge opportunity for more collaborative working. And the point about if you can get companies and other organizations to invest and work in your area, and you can gain the benefits of money to a certain extent, but also expertise, that ought to be a huge boost to that particular integrated care system. And we ought to be seeing the development of care systems right around the country, creating that environment where business and organizations really want to engage with and work with the health leaders. And I just look at the data, the digital side of things in the National Health Service. If you are outside the NHS looking in, you think we have a National Health Service. And so the data systems, how GPs and hospitals and all parts of the system interact with one another, from the outside, you would think this ought to be seamless. It ought to be all connected together. Well, when I hear as a Member of Parliament that in different parts of the country, you've got all sorts of different types of computer systems. They may or may not work in a local neighborhood. They may or may not work on an integrated care system area. And certain areas have paper systems. Certain areas still use paper files and records. And we can look and think things need to really move on. And I know a few years ago, there was a huge national effort to try and get a more joined up database. It didn't quite work out. Hopefully there were learnings taken from that. So looking at the NHS England as a whole and how you can get a data system that really works. Well, perhaps you can't as an NHS England, but perhaps you can as an integrated care system. Perhaps this does actually provide an opportunity where those GPs, those hospitals, all of those different elements within a particular area, Greater Manchester, a population of 2.8 million people, a very significant population, huge amounts of data being produced in this area. The university, other organizations here are world class. So there ought to be that opportunity here in Greater Manchester to really turbocharge that engagement with the life science sector. And it was really pleasing to hear Cheshire and Merseyside making really good progress in this direction. And one of the things as a Member of Parliament I want to see is the different areas, not necessarily in competition because that's a bit crude, but different areas emerging, using the skills and talents they have in those different areas, but also being a role model for different integrated care systems around the country. I know the Secretary of State, this is very early days, yeah, in terms of integrated care system as a whole, very early days, but I know the Secretary of State wants members of Parliament to be more actively engaged in challenging the integrated care systems. Obviously, we have a huge interest in terms of supporting and looking after our constituents. I don't know what forms the data will take. I don't know what platform we'll have as members of Parliament to really look at the integrated, whether the integrated care board or the partnership or the wider system to see what role we can have. Also, the media is immensely important. Other actors, patient groups, there are so many interested parties that ought to be participating, scrutinizing and challenging the system. Now, going back to the wider devolution agenda. So devolution at the moment in Greater Manchester, it's different in different areas, but I think there's a certain direction of travel. It does include transport. It does include housing and house building. There are a whole number of different things. Employment, obviously, is a huge question. Public transport, a huge question. So actually, many of the questions that we face, and were pointed out on the last panel, and no doubt would be more widely discussed, many of these issues in terms of the right sort of housing and the mayor having a input, and I wouldn't say responsibility, direct responsibility, but the mayor in different areas up and down the country can and should have an input into housing and perhaps raising standards of housing in a particular area. Well, that directly has an impact on health. And so one of the things I'm looking at in Greater Manchester is healthcare did become a mayoral responsibility in Greater Manchester. And I appreciate we've got a different system now. And I wonder, with the number of different elements of devolution, the economy, transport, housing, employment, all the things that go with it, policing and healthcare, perhaps healthcare will become a mayoral responsibility again in the future. And so as a Member of Parliament, to see all of those powers devolve to the mayor, as a Member of Parliament, it's going to be really interesting to see what kind of powers we have, what kind of data we gather on the integrated care systems, and more broadly, to see how we collectively and constituents and patient groups can actually challenge the political system in its devolved form. So I think there is an exciting opportunity, so many exciting opportunities ahead, and I'll be delighted to take any questions.
You did a big drill down there on the data systems and the lack of interoperability. And I know you talked about an optimism perhaps for ICSs to evolve their own systems, which of course they are. And I think Ben will talk fantastically about what Greater Manchester has been doing. But, you know, if I can give you a challenge just for a moment, you know, if you are a patient who has got, I don't know, a rare condition and you're in Manchester, but actually you have to go to Birmingham, it's no good working within the, you know, the ICS. So we do need to move to this kind of national. And I am cautiously optimistic this time about the role that NHS England are playing and the federated data platform that is going to be rolled out, which ostensibly is going to be the answer to all of our problems. And I'm an eternal optimist. So we will see on that. And also we now have these 11 secure data environments. And of course we have one in the Northwest. So I think that is also potentially going to bring some great opportunities. Can I just ask you though, and we had a lot of conversation on research and the value of research in terms of the value of it to patients, first and foremost, but also the financial values that it brings into the system. In your role as chair of the APPG, the All-Party Parliamentary Group on Medical Research, what's keeping that committee awake at night? And then I want to take some questions from the floor.
Well, the medical research, obviously aspects of the charitable medical research sector had a huge negative impact during COVID, because if you look at sponsored walks, marathons, that kind of thing, that's where a lot of the charitable sector received a huge amount of their money. But one of the, I think starting points in terms of medical research is how weighted towards the golden triangle we are. And you look at the expense of locating in London or Oxford or Cambridge or in that area, there's a huge amount of money, whether it's from the charitable sector, whether it's from the life science and pharmaceuticals, a huge weight of that money is being spent there, when the real estate and so much else is incredibly expensive. And that also means, in terms of clinical trials and other things, if we had a better distribution around the country in those areas, I think we'd get more bang for our buck. And also you'd reach out to communities. So as chairman of the APPG on medical research, we haven't yet published it, but we've just finished a report on health disparities. And if you can have greater engagement right around the country in terms of research and more patient populations, often in hard to reach populations around the country, if you can get more people engaged, then I think you can actually help people's health more, getting the populations where perhaps health conditions are slightly worse. But also, if you look at COVID, breaking down the barriers. One of the big challenges during COVID was reaching to some communities around the country. And if you can, over a period of time, look at the integrated care system, look at the local government public health aspects, they're in a fantastic position to reach into communities. And if we can get all of these parts connected up, on the innovation, on the research side of things, and getting more participants from, say, ethnic minorities or other hard-to-reach groups, you actually give the people who might invest more bang for their buck. You break down those barriers, and you actually improve the environment more broadly. And one big figure, I think from 2017 to 2021, there's almost, not quite, but almost a halving of clinical trials. I think third phase clinical trials, almost around about halving in that period of time, and halving the number of people participating. That's worth about, I don't know, 450 or so million pounds to the National Health Service. So we can get this boosted back up again. If we can get the United Kingdom and each of these integrated care systems participating more fully, that's a huge investment in the National Health Service.
questions from the floor. So if we can do what we did last time, come up to the microphone.
Hi, so I'm Andrew Wardley. I'm a former medical director within the NHS, and now I'm a CEO in a separate company. So I spent 23 years developing research systems in Greater Manchester, doing the very thing that you're suggesting should happen now.
Yes.
Working with pharmaceutical companies to build an infrastructure that enables you to do all the other research that you want to do. My challenge and the question that I ask to you and the ISSs is, how are you going to relift the system when there's lots of doctors, nurses and other healthcare professionals leaving? When there's been 20 years of no workforce planning from the government, that at the moment, a third of trainee doctors intend not to go into the NHS when they qualify. They will be taking roles outside of medicine or taking roles of medicine in other countries. So I'm a great supporter of research and I really wish you the very best success, but I want to know, how are you going to deliver it in the climate that we're currently in?
Thank you for that challenging question. I think the quote from Nicholas Timms from the King's Fund, he wrote an article, I think just before Christmas, the ICSs have been born into the mother of all storms. And I think that's a fair comment. Now, very crudely, I think that captures in that phrasing, being born into the mother of all storms, actually does capture the challenges we have. One of the problems, for example, in terms of people, most experienced doctors and others leaving the system, was on pensions. The Chancellor has hopefully dealt with that problem to a certain extent. Now, it's not going to be everything, but there are certain things like that the Chancellor, probably in the whole history of the British government, we've never had a Chancellor as with the depth of knowledge that our current Chancellor and former chairman of the Health and Care Select Committee as well, the insights he brings to it. And perhaps he's made one or two commitments. For example, he made the focus on the workforce planning, getting that workforce planning in place. He made that commitment or had that intention as Select Committee chairman. He is now on the process of delivering that. It takes a while to do, but that commitment is there. The work is ongoing to deliver it. So I think there are a whole series of different problems. And the starting point, I think, for any politician and for the Chancellor and for the government of the day is to say that we're taking those initial steps in the budget. We're going to secure a growing economy. I know it's very difficult, but by having a growing and strengthening economy, with the continued arguments and debates over healthcare, we can get that investment in the NHS. And there are certain things. I know dentistry. I haven't heard dentistry mentioned at the moment. I know a recent Secretary of State had the A, B, C, D, and then added D in terms of dentistry. One of the things that was highlighted on the Health and Care Select Committee just this week was that about 10% of the money spent on dentistry is clawed back because there is challenge with the funding systems, the funding models within dentistry. And when you look at the problems in terms of oral health, it's extraordinary that that's happening. So one of the areas where we're going to be putting pressure as a select committee is on preventative health in general, but also in terms of dentistry to make sure that things were 400 million, I understand the clawback is, that 400 million could and should actually be spent on the people who need that better oral health. So there's a whole number of things, and I haven't touched on all of them, but I think the arguments or the challenges you've raised have been well and truly heard back in Whitehall.
And you mentioned about the millions that research brings in. As we bring 20% of all commercial clinical research to the UK, and that equates to 1.2 billion every year into the UK economy globally. So it's not in the millions. So Chris, I think without further ado, I need to bring your session to a close. So if everybody would thank Chris in the traditional way, it'd be really grateful. Thank you.